So AminoFix is a product that's similar to something that you've heard before called ACell. It's a class of product called an extracellular matrix, which in essence is a scaffold. So think of a scaffold, it's like a physical structure. It's made of proteins and it's embedded with growth factors and other goodies that your hair certainly needs to help grow. So AminoFix is a product that's derived from human placental tissue. These are placentas that are donated by healthy young women with a healthy pregnancy, and the membranes that come from the amnion and the chorion. These are two separate membranes within the placental tissue. These membranes are used to produce the AminoFix product. So it is, in essence, a bioscaffold. So it's a complex of proteins that provides a structure for building blocks of regenerative tissue in the body. So AminoFix has been used in wound care for many years, and what it essentially does is it's like a stem cell magnet. Stem cells are really important for the healing of damaged or injured tissue. So in the case of hair loss, what we're talking about here is not damaged tissue so much as not a dysfunctional tissue. So the hair follicle stem cells, as we mentioned previously, are not functioning like they should be. So when AminoFix comes into the picture, it recruits stem cells from other areas of the body, other tissues that are functioning normally, which then proceed to help work on the stem cells that are not functioning from the hair follicles to improve the quality of the hair that's grown. So in years past, we've used a product called ACell, which is an animal-derived product. And now we're moving towards AminoFix. And the reason is that there's certain advantages, I think, that AminoFix has over ACell as a product to help stimulate hair growth. The first one is that AminoFix is a human-derived product from human tissue. ACell is from animal tissue. So ACell has to be broken down a lot further in the processing of the product before it can be injected into the scalp because it's not human. AminoFix, on the other hand, comes from placental tissue. Placental tissue, by definition, is something we call immune privileged. Well, what that means is that your body's not going to respond to it in a way that it would to animal tissue. It just doesn't recognize it as foreign. So this placental tissue is special that way. So AminoFix has that advantage, less immunogenic. And also the fact that it doesn't have to be broken down as much makes it much more biologically active within the tissue. So once it's injected in there, it acts like a stem cell magnet. So one of the other advantages of having AminoFix versus ACell is that ACell therapy required that we numb the entire scalp to deliver the injections. For a couple of reasons, one of which had to do with the pH balance of the ACell, and also the fact that the particle size required that we use a larger needle to inject into the scalp, which most people just wouldn't tolerate without numbing the head. So that required more fluid administration, the discomfort of having the injections for the numbing, etc., and it made for a longer treatment time. AminoFix, on the other hand, is a much smaller particle size, so it can be injected through a tinier needle. And what we've been able to do is administer this directly into the scalp without injecting any anesthetic. Turns out that in most cases, people will tolerate it as well or better than having the local anesthetic done. And now we're administering a fraction of the amount of fluid that people got injected with the ACell product. So it's a much smoother recovery, it's easier to administer. And all this really has helped to reduce the costs to the patient in terms of the treatment itself. And on top of that, in our first year of work with this product, the results have been as good or better than ACell in almost every single case. So I'm real hopeful that in the long run we'll see even better outcomes with AminoFix patients. So another common question is, what's the risk of having AminoFix injected into your scalp? As we discussed before, AminoFix is derived from placental tissue. So placental tissue doesn't stimulate your immune system, so the risk of having an immune response is quite low. In fact, in over 1 million uses of AminoFix product in other medical treatments, including wound care and joint injections, etc., there have been 0 reports of adverse events. So quite a good safety record there. So another question that people will ask frequently is whether or not you need to use PRP with AminoFix. Previous treatments with ACell and PRP, we determined that the combination of ACell plus PRP was the best way to go instead of using ACell without the platelet-rich plasma. So in the case with AminoFix, we're not quite sure yet at this point because we haven't done enough work with it over time to determine that. In patients with AminoFix without PRP, we've seen excellent hair growth. And also with patients that have had AminoFix in combination with PRP, we've seen good hair growth in these patients as well. So we don't have enough data to really compare the two and decide whether or not there's a distinct advantage to adding PRP to the AminoFix product. In other words, will you get additional growth or not? So that's research that's ongoing, and we are working with patients in the office to currently find that out. PRP, or platelet-rich plasma, can help hair follicles grow because it infuses the scalp with growth factors. These are specialized proteins that help stimulate tissues to grow. So injecting those into the scalp will often stimulate even weakened hair follicles to the point where they will slow down their demise, or in some cases even increase the growth of the hair follicle for a period of time. The problem with PRP is that these proteins tend to degrade fairly quickly within a matter of days, and so it's a big wash of these initially when the treatment happens, and then they go away fairly quickly. So I've often likened it to trying to drink water from a fire hose. You can only get so much, and then the rest of it seems to be wasted as far as the hair follicle is concerned. So what we've done in the past and currently still do is to combine PRP with an extracellular matrix like AminoFix, or in the past we've used ACell. And the advantage of doing it this way is that the extracellular matrix structure will actually capture some of those growth factors that can't get used immediately and hold on to those. And they get released slowly as this extracellular matrix gets naturally broken down by the body. So it's a little bit of an extended or slow release mechanism for these growth factors into the scalp over time, which allows you a less frequency of treatments to be required. So for instance, if you were just having PRP therapy without the extracellular matrix, you might need to get 4 or 5 treatments within the first year. If you're using ACell or AminoFix with PRP, you probably just need 1 treatment and then another one in 18 to 24 months. In cases of patients, the exception to that rule is in cases of patients that have excessive hair loss or real aggressive hair loss, and we really want to be aggressive back, that frequently we'll use 2 of these treatments within the first 4 to 6 months and then go down to our 18 to 24 month interval for treatment after that.